Neurosurgery represents the pinnacle of the surgery, which is highly complex and time-intensive. An operation commonly takes a dozen hours or even longer. During this period, how do doctors and nurses organize their troops and level up? Except for emergency trauma surgery, neurosurgery generally is elective surgery, which requires scheduling in advance, carrying out examinations, and making all necessary preparations. Before the surgery, the chief surgeon will have an in-depth conversation with the patient and their family, informing them of the surgery plan, its risks, as well as other pre- and post-operative issues. On the day of the surgery, the patient is taken into the OR and placed on the operating table. They are surrounded by major instruments such as microscope, ventilator, and monitoring equipment. The anesthetist will help the patient gradually descend into dreamland and position the patient according to requirements of different surgeries. The nurses will be busy adjusting the operating table, and after everything is fully prepared, the chief surgeon takes the stage. Next to them, the instrument nurse stands by with their diverse armory waiting for orders. In order to protect the vital and fragile brain, our skull has evolved to be exceptionally hard. After opening this hard bone, the surgeon will open the dura, arachnoid, and the pia mater step by step, and advance through layers of obstacles to the lesion. Then they will meticulously detach it from the healthy tissue and remove it without hurting important nerves and blood vessels in its surroundings. The chief surgeon often has to adopt various awkward positions. Especially the patient's semi-sitting position requires the chief surgeon to keep their arms suspended and their head tilted upwards for many hours. Under these stressful conditions, the surgeon has to maintain a high level of concentration until the tumor is finally removed. At last, the assistant surgeon proceeds to close the skull and sutures the scalp. After awakening from anesthesia, if the patient's condition is stable without significant complications and they can breathe on their own, then they will be transferred back to the normal ward. Critical patients are sent to ICU instead. If the patient's vital signs are unstable or they can't breathe spontaneously, they may need to be kept intubated for a long period. Once their condition is stabilized, after a follow-up CT scan, the patient can be transferred back to the general ward, at which point the family can finally rest assured, because it means that a few weeks later they can be discharged and go back home. Maximum resection, less post-operative complications, fast and good recovery of neurological functions all indicate a very successful surgery. But this requires high technical skills of the surgeon, close cooperation of the whole surgical team, availability of cutting-edge equipment, and so on. During this thrilling time, most of the patients just sleep from the beginning to the end and wake up to a new life. Sadly, however, there are also patients who never wake up after the surgery despite the best efforts of the whole surgical team. Neurosurgery is indeed a fight for lives. After all, it's not easy to operate on the brain. The best the patients can do is to choose a neurosurgeon who they trust to lead them through this difficult battle.